So you have a sore throat and it hurts to swallow and something just feels off in the back of your throat. Is it an infection or is it one of those tonsil stones that you keep hearing about? This is one of the most common points of confusion I see in my practice. Patients come in thinking they have one thing when they actually have another. While they both happen in your tonsils, tonsillitis and tonsil stones are two completely different medical issues with different causes and, most importantly, different treatments. Today, we're going to clear up that confusion so you can better understand what might be happening in your own throat. First, let's talk about tonsillitis. The simplest way to think of it is as an active infection of the entire tonsil gland itself. Whether it's a virus or a bacteria you're fighting, the entire tonsil tissue becomes infected and inflamed. The causes are typically either a virus or a bacterial infection like the strep bacteria. This leads to a very distinct set of symptoms that usually come on fairly aggressively and pretty quickly. With tonsillitis, you'll often experience a sudden and often severe sore throat, visible redness and swelling of the tonsils. You might see white spots, but this is pus, a sign of infection, and not a hard stone that comes out easily. You'll likely also have fever, body aches, and generally feel pretty unwell. You may also notice swollen, tender lymph nodes in the neck. Tonsillitis is an acute illness. You will feel sick because your body is actively fighting an infection. Tonsil stones, on the other hand, is not an active infection. This is a structural problem along the surface of the tonsil. The cause, like we've discussed in other videos, is the anatomy of your tonsils themselves. Your tonsils have small pockets or crevices called tonsil crypts, and these crypts can trap debris, like food particles, dead cells, and mucus. Over time, this debris hardens and calcifies, forming a stone. The symptoms of tonsil stones are very different from tonsillitis. They're often chronic, meaning that they're a recurring, long-term nuisance rather than a sudden illness. With tonsil stones, you're more likely to experience the feeling of something being stuck in your throat. The primary complaint is often chronic bad breath or halitosis, which is caused by the bacteria in the rotting food of the stones. You may see the white or yellow hard chunks themselves, and they're relatively easy to dislodge if you can see them. While you might have some mild irritation, you won't quite have the severe pain and the systemic illness that comes with tonsillitis. With tonsil stones, you don't really feel sick. It's really more of an annoyance and a frustration. So let's put them side by side. The causes of tonsillitis are an actual infection, whereas tonsil stones are a structural problem along the surface of the tonsil. Primary cause of tonsillitis is a bacterial or viral infection, whereas a tonsil stone is debris trapped within the tonsil crypts. Pain level for tonsillitis is typically acute, moderate to severe, whereas the pain level for tonsil stones is usually chronic and is mild, really more of a sense of irritation. The key symptom of tonsillitis is feeling unwell generally and having a fever, whereas the key symptom of tonsil stones is bad breath or just feeling like something is stuck inside your throat. The duration of tonsil infection is typically days to a couple of weeks if adequately treated, whereas tonsil stones are a recurring long-term issue. What you see when you look with tonsil infections or tonsillitis are red swollen tonsils with white patches of pus, whereas with tonsil stones you typically see whitish, yellowish, hard particles that move if you push them. As you can see, while they occur in the same location, they are fundamentally different conditions. This distinction is critical because the right diagnosis is what leads to the right treatment. For tonsillitis, treatment typically involves managing the infection. If it's a viral cause, we do rest in fluids. For a bacterial cause like strep, we prescribe antibiotics. A full tonsillectomy or removal of the tonsil is only considered for cases of severe recurrent tonsillitis, like many episodes a year for multiple years. But for tonsil stones, antibiotics may help you feel better temporarily by addressing the inflammation, but there's actually no infection to treat. It's really more of a surface problem of the tonsil stone being stuck in the crypts. At-home removal methods, as we've discussed in previous videos, are temporary and can be risky because of potential tissue damage or forcing the stones deeper into the crypts. Because tonsil stones are a structural problem, sometimes they require a structural solution. This is why we perform resurfacing procedures of the tonsils like laser tonsil cryptolysis. The goal of resurfacing is to precisely reshape the tonsil surface, shallowing out the crypts and eliminating the hiding spots where the stones form. So if your symptoms are sudden, severe, and you feel sick all over, you may actually have tonsillitis and you should see your doctor. But if you're in a chronic cycle of bad breath, irritation, and seeing those annoying little white chunks appear again and again, you are likely dealing with tonsil stones. Getting the right diagnosis is the first step toward getting lasting relief. If you're tired of the endless tonsil stone cycle, I invite you to take that step. Click the link in the description below to visit our website at ENT of Georgia South. You can schedule a personal consultation either in person or virtually by telemedicine to finally get a clear diagnosis and discuss a permanent solution. Thank you for watching.